Namaste, I am Dr.S.Jayaraman. I am a consultant pulmonologist. I am the Secretary of Indian Medical Association, Academy of Medical Specialties, Tamil Nadu State Chapter. World Sleep Day. Every year in the month of March, this year March 15th is a World Sleep Day. This is an awareness program for the doctors and the general public. Awareness means mainly, you all know very well, sleep is an essential for life. Every year they have a theme of World Sleep Day. This year theme of World Sleep Day is Sleep Equity for Global Health. Sleep is such an important thing. Sleep is a vital metabolic function of the body like breathing, respiration, excretion, reproduction. This is one of the important metabolic function, sleep. An average adult, we have to spend the sleep for 6 to 8 hours. So 1/3 of life we are spending on the sleep. If we don't spend on the sleep for 1/3, so the lot of metabolic diseases, not only metabolic diseases like non-communicable disease like diabetes, hypertension, high cholesterol and the obesity, cancer, etc. Non-communicable, there is a communicable disease because of low immunity, immunosenescence, weakened immune system which leads to infection. There is a link between immunity and sleep. There is a link between sleep and cancer. So sleep is a vital metabolic function of the body. So very essential for health. So during sleep only our body rejuvenate, repair mechanism, consolidation, memory consolidation. So lot of balancing activities, hormone secretions, bad hormone, good hormone balancing activity, growth hormone secretions and lot of repairing mechanisms takes place during sleep. So sleep is such a vital important thing. So the physiology of sleep is an enormous one. An average adult we have to spend the sleep 6 to 8 hours. There are a lot of sleep disorders. As per the American Academy of Sleep Medicine, there are 7 classifications of sleep disorders. The common sleep disorders in practice are insomnia. Insomnia means not able to get a proper sleep, or lack of sleep, or inability to get a good satisfied sleep. This is a insomnia. Other spectrum of sleep disorder is the sleep apnea. In the sleep apnea, there is a sleep disorder. This comes under the sleep disorder breathing. The sleep disorder breathing comes under the sleep related breathing disorder. This is a spectrum of sleep disorder ranging from snoring, upper airway resistance syndrome, sleep apnea hypopnea syndrome and obesity hyperventilation or Pickwick syndrome, we call it as. So there are a lot of sleep disorders. If any person is having snoring, slowly may progress into upper airway resistance syndrome and sleep apnea, obstructive sleep apnea syndrome and obesity hyperventilation syndrome and all. So among the sleep disorders, the sleep apnea is a very important. This is equivalent to malignant disease. Other sleep disorders we call it as a benign disease, but the sleep apnea, mainly the obstructive sleep apnea, considered as a mother of modern epidemic disease in the world. Such an important thing. There are a lot of link between the sleep apnea and major diseases like heart attack, stroke, cancer, accidents and psychiatric illness diverse because of the marital disharmony, loss of libido, etc. etc. So among the sleep disorders, the sleep apnea is a very important thing. Under the sleep apnea, the obstructive sleep apnea is common under the sleep disorder breathing. So the common symptomatology of obstructive sleep apnea are daytime symptoms and nighttime symptoms. Daytime symptoms mainly excessive sleepiness, tiredness, fatigue, accidents. There are a lot of things. Nighttime symptoms mainly snoring, insomnia and choking, gasping. Because of this sleep awakening, there are a lot of disturbances during sleep. So we have to meticulously ask the history. There are a lot of clinical questionnaire for obstructive sleep apnea. Only we commonly use the questionnaire or the stop bank questionnaire. So in that we have to ask certain questions and find out the probability of obstructive sleep apnea, whether high probability or low probability. How to confirm the sleep disorder breathing? There is a test called a sleep study or polysomnography. Level 1 or level 2 sleep study, we call it as a polysomnography. Level 3 study is a home sleep apnea testing, we call it as a polygraphy. We record mainly the cardiorespiratory channel. In the sleep test, we confirm whether patient has what kind of sleep disorder. We have to proceed with the treatment part. Once diagnosis confirmed there is a sleep apnea, the treatment is multidisciplinary. We have to involve the ENT surgeon, we have to involve the psychiatrist, and involve the bariatric surgeon, dental and oral and maxillofacial surgeon. This is a combination treatment. Endocrinologist part is very, very important. So among all the treatment, the first line treatment is CPAP. CPAP is considered as a gold standard first line treatment. Those who are not able to tolerate the CPAP, we have to think in terms of a non-PAP therapy. That is, a PAP means PAP, positive airway pressure therapy. We have oral appliances, and we have a maxillomandibular advancement procedures. We have upper airway surgeries, co-ablation techniques, and pharyngeal lingoplasties, pharyngeal expansion procedures. A lot of procedures. We involve the ENT and oral and dental and maxillofacial surgeons. And if the patient is morbidly obese, the body mass index more than 40, we involve the bariatric surgeons. And hormonal corrections, mainly the hypothyroidism and other hormone imbalance, we involve the endocrinologist. So treatment is a multimodality. We have to control the disease or cure the disease. Otherwise, it may lead to a lot of complications like a heart attack, stroke, cancer, accident, psychiatric illness, divorce, etc. So sleep apnea is a very common disorder. That's why every year we do a sleep awareness activity to commemorate World Sleep Day. So this year, March 15th, for the awareness purposes, for the professionals like doctors and medical practitioners, we do awareness activities, see me and all. For general public also, we are doing a lot of awareness activity. That's why the World Sleep Day. So each and everyone has to spend time for good sleep. Good sleep is essential for health. This year theme is the sleep equity for global health. Thank you.